Good evening. I'm Mayor Ron Nirenberg, joined tonight by Dr. Ruth Berggren, who is the COVID liaison for Judge Nelson Wolff. We're also joined by Dr. Jim DeWoo, who is our local public health authority and medical director for San Antonio Metro Health. And this is our COVID-19 update for the San Antonio community. Tonight we're reporting 77 new cases of COVID-19, which brings the total to 201,273. Please note that there was a delay in receiving results from the curative labs, so this number appears a little bit lower than it really is, and we should have a correction over the next few days as those curative lab results come into our community. Our 7-day rolling average, again, which is an accurate picture of how this pandemic is progressing, is 146. Fortunately, there are no new deaths to report tonight, but as you know, we have lost many of our loved ones and neighbors, so please keep their survivors and families in your prayers this evening. There are 202 patients in our local hospitals tonight. That's down 6 from yesterday. Over the last 24 hours, there were 37 new admissions. 79 patients are in the ICU, and 41 are on ventilators. And again, those numbers are trending in the right direction. The hospitals, again, being an ultimate picture of how this pandemic has progressed over the last several months in the community, and that is going in the right direction, but the fight against COVID-19 is not over. So please wear your mask, practice social distancing, wash your hands, and get vaccinated when it's your turn. As of yesterday, 387,892 people in our community have received their first dose of the COVID-19 vaccine, and 215,467 people are now fully vaccinated in Bexar County. Those are very good numbers, but clearly we have a ways to go, so that's why it's so important for us to continue to do our part to slow down this spread of the virus. Metro Health would like to announce that people who are scheduled for the COVID-19 vaccine at the Alamo Dome on April 2nd will be rescheduled to April 5th at the same time. Again, those who had vaccine appointments at the Alamo Dome scheduled for April 2nd, your new date is going to be April 5th at the same time. We appreciate your patience and thank you for understanding. Let me turn it now to Dr. Berggren for a county perspective.
Thank you very much. I'm glad to be here with you. I can't overemphasize the comment you made about asking people to continue to be vigilant. I just was on the wards at University Hospital today, down in the emergency room, admitting new patients. Fewer than we have been admitting, but each person who comes in has a story, and some of them are very sick. These numbers regarding vaccination are so encouraging, and I just want to highlight that a little bit. You know, if you add to those numbers nearly 100,000 that will have been vaccinated or doses administered at UT Health by the end of the week, we're going to be looking at nearly 500,000 people in Bexar County, or 500,000 doses of vaccine that have been given. And globally, around the world, more than 360 million doses have been administered. So for everybody who is saying, you know, I want to wait until a few people get vaccinated before I get my vaccine, I have good news for you. More than 360 million people on planet Earth have gotten these vaccines, and we haven't seen any new concerning safety signals. In fact, we're only getting good news. Earlier this month, Pfizer announced from data out of Israel that not only was the vaccine 97% effective in preventing symptomatic disease, it was 94% effective in preventing asymptomatic disease, which means that these vaccines are drastically reducing the possibility that people will go about shedding virus asymptomatically. So we're making true progress on our exit ramp of this pandemic. I would like to also highlight that people can get vaccinated at UT Health. Initially, we were vaccinating our campus, our healthcare workers, and our patients, and we are now extending that to appropriate tiers of the general public. If you were to go to our website at this moment, you'd find out that we are booked for the next 2 weeks. However, on Monday, we should have a functionality that will permit you to register yourself, and you will get contacted when it's possible for you to get a vaccine appointment. Thank you.
Great. Thank you very much, Dr. Berggren. And together with Dr. Wu, both of you have been representing a great many thousands of people who have been working on the front lines of this pandemic. So from all of us to the folks that you work with on a daily basis. Thank you very much to our medical professionals for keeping us safe and leading us in the right direction here as we try to get this pandemic behind us, which we do again have a ways to go, but we do want to remind you that if you're struggling through this pandemic paying rent or mortgage, there is assistance available for you. You can call 311 or go to covid19.sanantonio.gov to access the Emergency Housing Assistance Program that will avail you of rent assistance during this pandemic. Also, if you're out of work and without an income, you can enroll in our workforce training program to train for jobs that are available today in our community while you receive a stipend to make ends meet. You can enroll in that program by calling 210-224-HELP, and more information again by calling 311. As always, you can get the latest on COVID-19 by texting COSA-GOV to 55000 or by going to the website covid19.sanantonio.gov. And if you'd like to receive a text alert when appointments for vaccines are available through one of the public health providers, you can text vaccine or vacuna to 55000. Please continue to do your part to protect yourself and your family and friends from this virus. Mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Dr. Wu, Dr. Berger, and myself are available for questions.
Mayor Nirenberg, can you discuss the city's emergency assistance program that helps people with housing and other urgent issues, and discuss how they get access and what will the impact of the latest federal stimulus legislation be?
Sure. Well, it's been a year now since working together with the county. We have essentially put all of our chips on the table, everything that we could muster in terms of resources of this community to make sure that we could all get through this pandemic together as unscathed as possible. And that includes making sure people could keep food on the table and a roof over their heads. And we are not out of the woods yet, but there is a housing assistance and other direct assistance available. All told, the city has allocated $133 million to emergency housing assistance. It's by far the largest program in the state, if not the nation. So all those programs are still available, and if folks need help, we're urging them to call 311, or you can go to the website covid19.sanantonio.gov, and there will be navigators to help you through which portions of the assistance that you need. We are absolutely grateful for the federal government continuing to provide a lifeline to not just San Antonio, but cities across the country and states to ensure that we have additional resources available to keep these programs running. But it has been a cooperative and collaborative effort from the federal, state, and local level.
Mayor, can you comment on the comments made by Congressman Chip Roy today in light of the vandalism, hate-related vandalism San Antonio is experiencing?
I didn't hear comments that Congressman Roy made. All I will tell you, I don't know what he said, but we did have a press conference hosted by DA Joe Gonzalez that made our thoughts on the incidents of anti-Asian hate across the country and even here in our community very clear, and that is it won't be tolerated. The way we drive out hate is through love and compassion. Our community is not immune from those actions that are manifest by hate, but we certainly stand tall in working together, standing for one another, and driving out hate when it does occur, and we will continue to do that.
That's all we have tonight. Thank you.
Thanks.